Hello, my name is Gabby and today I'll be performing the NG tube scales insertion video. I have my Nightingale scrubs and my badge. Before we enter the patient's room, I'm going to gather all my supplies, sterile gloves, the syringe, the NG insertion tube, briefs, lubricating jelly, paper clips, a pH paper, and pH solution, lubricating jelly, water cup with a straw for the patient, and something for the NG tube. Okay, and I'm going to start off by making sure I gather all my supplies and perform hand hygiene, and I'm going to enter the patient's room. Knock, knock, knock. Hi Mary, my name is Gabby. I will be performing NG tube insertion for you today. I'm going to close the curtain for privacy. Can you please verify your name? Mary, August 1st, 1991. Okay. We're going to perform the NG insertion to help you with your upset stomach and take some of those gastric contents out as per doctor's orders. And I would verify the orders before going into the patient's room. I'm going to grab vitals from you, make sure your vitals are within normal limits, and make sure your oxygenation. You're oxygenated. Okay, Mary, before we start, I'm just going to use my pen light and check your nostrils of any obstructions. I'm going to use my pen light and shine the pen, see if there's any obstructions. Okay, that looks good. I'm going to cover, I'll cover one of your nostrils if you can take a deep breath. And then the other one. Okay, looks like we're going to be using your right nostril because that has a little bit stronger airflow. Okay. Okay, Mary, we're gonna start by, I'm going to raise your bed to a working level and sit you up in high Fowler's position, and I'm going to give you cover just with this brief on top to make sure we get nothing on you. Okay, and all right, so first I'm going to start off by measuring the NG tube clamp to see how far we have to go in. Okay, I'm going to start by the tip of the nostril and go by the tip of the nose and down to the xiphoid process, which is going to be about 55. Okay, I'm going to measure that with some tape just so I know my placement. Okay. And then Mary, if you start to feel like you're going to feel a gag reflex, so we can stop if you need a second. If you can just raise your hand. I'm gonna add some lubricating gel and go in, and you can take sips of water as needed. Okay, if you start to feel gagging. Okay, so I'm going to start by adding the lubricating gel, and we're going to start, Mary. Okay, so I'm going to insert. Now that I've come to there's some gagging. Okay, we're almost there, Mary. All right, and once I reach my placement, we're going to wait for X-ray to come and verify this placement for you, Mary. Okay, I'm just gonna going to cover this with a little bit of tape so that there's so that we know our placement. And while we're waiting for the chest X-ray verification, I'm going to unclamp this gastric tube and take out about 10 to 15 cc's. Okay, Mary, and I'm going to clamp this back. All right, I'm going to verify. Now I'm going to use this basin to insert the gastric contents, and I'm going to use my pH paper to verify that it's between 3.5 to 5, which would indicate we're in the right spot. Okay, Mary. Now that the X-ray has come in and verified that the placement is correct, I'm just going to place some more tape so that your NG tube is positioned in the right spot, and I'm going to hook this up to suctioning, and going to check every 2 hours. Mary, we want to make sure that we're keeping you no lower than 45 degrees so that you don't aspirate or choke. Okay, Mary, you did very good. I'm going to gather all my supplies, clear the room, or gather my supplies, clear everything, take off my gloves, and clear the room, gather all my supplies. Oh yes, and I'm going to document how the procedure went, the gastric contents, and the frequency and how it looks like, the description of the contents as well. And I'll take this away, Mary, too, okay? All right. Okay, thank you.